go.
Okay, so I have one job.
So I'm going to take away that point and all right, we're going to identify various skills needed for support services, determine general education and state requirements, and identify various occupations connected to support services. Support services is an important branch of the healthcare system, but one that often goes unnoticed by patients. In general, people that work in support services are the backbone of any healthcare facility. Support services employees work behind the scenes to make sure others can perform their functions in a sanitary and therapeutic environment. This support varies based on the role and can include cleaning and maintaining equipment to making sure equipment or information is readily available. Skills needed. Careers within this pathway vary and often require different and sometimes specialized skill sets. In general, people who want to work in support services should have the following skills: knowledge of sterilization procedures, organization, reading and interpreting information. Education requirements. They vary widely in support services depending on the job you choose to pursue. Some positions may require an associate or bachelor's degrees, while others may not. Many employers offer extensive on-the-job training. Do you research and get help from your career counselor and your family to help you determine the best match between your skills and interests in a future career? All right. When you guys do your worksheet, you'll click on the things and it'll tell you each of the information. A biomedical equipment technician, or a BMET, also called a medical equipment repairer, is responsible for maintaining and repairing medical equipment. Hospital maintenance engineers are responsible for maintaining the extensive heating, air conditioning, refrigeration, and ventilation systems in hospitals. Industrial hygienists are actually engineers and scientists who protect the safety and health of people in the workforce and ensure that state and federal regulations are followed. Medical librarians do much of the work a typical librarian would do, but they work with health-related material. Many provide information to families, work with medical staff to approve educational resources, or to collect data and manage newsletters. Environmental services technician is responsible for the safety and cleanliness of a hospital or other healthcare facility. This includes traditional janitorial tasks like mopping and dusting, but also requires an understanding of proper handling and disposal of biological waste. Central services technicians are responsible for decontaminating, cleaning, processing, assembling, sterilizing, storing, and distributing the medical devices and supplies needed in patient care, especially during surgery. Materials management technician is responsible for managing inventory in the hospital. They make sure the proper materials are in the right place at the right time. Dietary technicians work alongside registered dietitians in hospitals, nursing homes, long-term care facilities, and many other places to develop healthy menus for individual patients. And that is it.
So, question: what happens in the NICU where she works, or in the ER where I work, when the monitors that we use to monitor heart rates and respiratory rates, or the ventilators we use to breathe for sick babies or sick people, what happens when those things don't work? You think that's good?
No.
Do you think a regular mechanic can probably fix that? An auto mechanic? No, it has to be someone specifically trained on that equipment. So the people that work in the hospital that are those biomedical engineers, they are huge to us because we have lots of equipment, and if that equipment's not working, it's a big deal. So I think sometimes people don't realize the importance of a job like that. And so actually one of my students, the very first year I had this class, he's actually going to school to be a biomedical technologist because he was he liked tinkering on his cars and working with his cars, but he liked medicine too. But so it's a really cool thing that I think some people don't think of. All right. Bye.
Good work, guys. Seeger, I really hope your football skills are better than your drawing skills. Right? Just putting that out there. Don't quit your day job, okay? No, you actually did really good. And everybody guessed what you were drawing. So obviously it wasn't.
So it doesn't matter how bad it was, like it worked.
I thought it looked like